Thank you, Chrissy, and welcome everyone. Good afternoon. Dr. Strang will now give us an update on COVID-19 cases in Nova Scotia.
Thank you, Premier. Good afternoon, everybody. Today we're announcing 14 new cases of COVID-19, bringing the total number of confirmed cases in Nova Scotia to 207. We still are able to say that the majority of our cases are linked with travel outside of Nova Scotia or connection with a known case. Today, that's about 92% of our cases we have that. But there's still some cases where we either haven't finished the investigation or we still have one that we know that the only conclusion we can draw is community spread. But we're seeing some signals of that make me increasingly concerned that we do have the beginnings of community spread here in Nova Scotia, as public health does all its follow-up at the local level. I'm pleased to say that we have 5 individuals in hospital. I have to correct, I misspoke yesterday, and I used the number 9, but it's 5 people that are in hospital. That remains the same today. We now have 21 people that can be considered to have recovered from their infection and they resolved their issues with COVID-19. So that's really good news. We now have the latest date number is 8,234 Nova Scotians who have been tested and have negative results. The lab, the QE2 lab, did over 800 tests again last night, and this weekend they're moving to a 24/7 operation to further maximize their capacity to test individuals. And again, I want to echo my thanks to my laboratory colleagues for their creativity and hard work to make sure we have the lab capacity necessary. I was asked yesterday to provide an update on the investigation at the Magnolia Long-Term Care Facility. I spoke with the Regional Medical Officer of Health this morning, and he advised me that we still, and I'm pleased to say, there's still only the original 3 staff and 2 residents who have tested positive. There are no other staff or residents who have developed illness, and we continue to investigate that. There was both an educational event for staff, and now we've learned that there was also a family gathering on March 11th at that facility that brought out-of-province visitors. So, as I've said previously, it's a complex investigation with lots of interactions between staff and residents and the community, and we continue to investigate that. But the good news is there's nobody new ill in that long-term care facility. There has been a lot of discussion and opinions and questions about masks in the last few days, and I'd just like to take a moment to speak to those. As I said yesterday, there's some growing evidence around potentially the effectiveness of the general public wearing masks. The Public Health Agency of Canada is looking at that, and and they'll be, as soon as they can, they'll be providing a review of all that of evidence to inform public chief medical officers of health in all the provinces and territories, and we'll use that to guide further actions. All that information is being looked at on knowing that it's important. We have global and national supply challenges around masks, and it's very important that surgical grade masks are preserved and used for healthcare workers and other essential workers. So even now, if the public are choosing to use masks, it's really important that they do not use surgical grade masks. Those need to be preserved for those who truly need them. There are also a lot of questions and around healthcare workers. We continue to get a lot of pressure around using certain types of masks for healthcare workers. There are national guidelines developed by experts in infection control that guide infection control measures that we're using those in Nova Scotia, and they include directives on or guidance on what type of masks and other personal protective equipment are required to keep healthcare workers safe. We know that because COVID-19 is spread by droplets, it is not airborne spread, that there are only specific circumstances in a healthcare environment where an N95 mask is required. Now, especially when we have these supply challenges, as I said, globally and nationally, it's very important that we use masks as appropriate. And the pressure to use N95 masks, higher levels of personal protective equipment, where the evidence does not say that they're necessary, quite frankly, puts us into the possibility where in a few weeks' time, as we get more Nova Scotians in hospitals, that we may not have the supply of N95 masks that are necessary in circumstances where there's no disagreement at all that N95 masks are necessary. So it's the appropriate use of masks, both for the public and in a healthcare setting, is critically important that at this time, especially in the situation when we have challenges on the personal protective equipment supplies, and that is a global issue. We're now into our 4th week of our experience with COVID-19, and we are at, you've heard me say this week, this is a very important time, if not a critical time. We are now starting to see signs of community spread in Nova Scotia. I do not believe it's widespread, and we are continue to expand our testing to be looking for spread within Nova Scotia, not just based on travel, and there'll be more to come on that in the near future. But it's the next few weeks as we start to get community spread, the extent, how much it spreads in communities and how many people become ill and how much pressure, how big the wave is as we move in towards the end of April on our healthcare system, quite frankly, depends on how we all work together to do the things we need to do to prevent the spread. So that is staying apart, staying home as much as possible. We know that these are challenging directives for people and families and businesses, but it's critically important. The basic message is stay home unless there's essential reasons why you don't need to be at home. So we know everybody needs to go shopping. So have one person go and get groceries, go to the bank, get gas, go to the pharmacy. Limit those visits. Try to plan ahead. There's lots of online grocery store ordering options. Many of the pharmacies are delivering. So think strategically and try to visit maybe once a week, not every couple of days. Is not the time to have social gatherings, even though we've said, social or 5 or less, but those are meant for essential times when people need to get together and to govern how people to get together when they have to go to the grocery store and other things. It is unfortunate. It's the time to get to connect with each other, absolutely, but do it virtually. Do it by the telephone. An old-fashioned way of writing letters, all sorts of creative ways, but now is not the time to be getting together, even if you think you can do that while respecting that 6-foot distance. I was reading an article last night which talked about the concept of family units, and I know not everybody lives in families, but in groups of people together, that we need to think about that's that unit that has to stay connected but isolated from the rest of the community as much as possible. Every time somebody goes out into the community, it does increase the risk of taking the virus into the community or bringing the virus back into that family or home unit. So we need to minimize that as much as possible. So if you have a teenager who's going out to meet their boyfriend, or if you want to get together, even to chat with your neighbors, each of those puts your family unit at risk, but it also creates the opportunity for the virus to spread within our communities. If we strictly adhere to stay home as much as possible, and as well as hand washing and all those other methods of protecting yourself, we can minimize minimize the impact and slow down the spread of COVID virus within our communities in Nova Scotia. The next few weeks are absolutely critical. We don't want to be doing this after being lax for a few weeks, and then all of a sudden we wake up and we've kind of missed the boat because we've allowed COVID to spread more than was necessary, and we've not taken the appropriate steps to minimize that. Again, I recognize that this is challenging, but we have to do this to protect each other, to protect our community, and protect our healthcare system. We're all going to need that healthcare system at some point, and we need it to be there for when we really need it. As we head into the weekend, I really want people to hear that message, but I also want people to do things, do it in a sense of caring for each other, do it in a way that builds community, not tears community apart, and quite frankly, use common sense. we are getting, when I say we, my communications colleagues in the Department of Health and Wellness, we're getting flooded with people's questions about, can I do this, can I do that? Stop looking for loopholes, please. Use your common sense. It may be challenging, but it's actually not that, in my mind, it's not that difficult to understand. Stay home as much as possible. Stay away from each other. Stop looking for loopholes or reasons to try to get around this. That puts us all at risk.
So Nova Scotians, you've heard it from Dr. Strang. If your teenagers want to go see their boyfriend and girlfriend, blame him. You can say, no, I wish you'd been around when I had teenagers. We'll take it. We'll take any questions you may have.
Thanks, Premier. Just a reminder, there'll be one question and one follow-up per reporter for the time that we have allotted for today. First question will go to Cassandra Nadeau-Lamarche from Radio Canada.
Good afternoon. So this is for Premier. A few weeks ago, in one of your announcements, you granted $15 million to internet providers to accelerate the Internet for Nova Scotia initiative. So can you give us an update on that and how the money is being dealt with and if it's really working?
Yeah, we had put together over the last number of fiscal years almost a $200 million trust that we were using to invest in high-speed internet across Nova Scotia. What we did a few weeks ago was incentivize those companies to actually speed up that connection, and there will be an announcement coming out where they are. I think there's another 1,600 households that have been connected since I made that announcement, and work is still ongoing.
Cassandra, do you have a follow-up?
Yeah, so yesterday, NB Premier Blaine Higgs said that if they increased the testing capacity, they could run out of testing kits pretty quickly. So what's the situation on that here in Nova Scotia?
I in communication on a daily basis with Dr. Hatchett at the lab. He's very comfortable that we can continue to expand our testing, and they continue to look for creative ways to make sure we have the right supplies. One of the things we're doing is we have a new type of swab which we have lots of supply of. It's not the swab we've been using up till now by and large, but we're doing some tests to compare the current swab and this other swab which we have lots in supply of, to make sure that they perform equally well in terms of validity of testing, and he feels that they will be. They just need to validate that, and that gives us a significant new supply of swabs. So there is always the potential that we may run into supply challenges in the lab, but right now Dr. Hatchett is very comfortable and is working creatively. There are national initiatives led by the federal government as well to ensure labs have adequate supplies. So we have what we need for now, and there are ways that we're working nationally to make sure we continue to have that.
Great, thank you. Our next question will go to John McPhee with the Chronicle Herald.
Hi, this is a question for Dr. Strang. You say there are indications that community spread is becoming more widespread, but there's no confirmation of this. Like you're not certain. Can you elaborate on that? What makes you say that there's more community spread, but you're not sure?
So when we investigate a case, we do extensive interviews with the case and where they've been, who they've been in contact with. And as I said, in the majority of cases, we're very clear. We're able to say that person traveled, or clearly that we have, clear evidence that they were in contact with a known case. Often that known case had traveled. There are some cases, and that this is where we're still under investigation. But as I discuss these cases with the regional medical officers of health, there are becoming more cases where it's becoming clear that it's going to be once we get to the end of the case investigation, it's less likely that they're going to be related to travel or a known case. But we haven't reached the end of the investigation yet. But it's on that basis, as I review the cases that we're seeing, we're starting to see more cases, still a very small minority, but a small growing number of cases where it's likely that we're going to come to the conclusion where it's spread in communities. We're also looking at what we're hearing from communities as well, and we're looking at those kind of things. And the third piece is we just have to be honest with ourselves. We have to look around the world and across other jurisdictions in Canada. In every jurisdiction in Canada, it started with the introduction from travel. And then that went along for a period of time, and then you started to see indications of community spread. And now in BC and Ontario, Quebec, they have widespread community spread. So let's not be naive and expect that's not going to happen. But what I want people to understand is that how much that happens and how bad it gets is within our control. So it's important that we stick with this, even though we may see more spread in the next few weeks. Don't take that as an indication that what we're doing isn't working. We need to stick with it, and the amount of spread we get, we will see more, but the amount of that spread is within our control if we all do things that we need to do to help each other be safe.
John, do you have a follow-up?
Yes, I do. There have been a lot fewer influenza cases and quite a big drop in flu deaths this year compared to recent years. I think there's so far 6 people have died from the flu this year compared to previous years where it's been over 30, and the total number of cases seems to be down. Could there be some link to the COVID-19 lockdown environment, or is this just a coincidence?
I think it's a coincidence. The lockdown has happened as we're trailing off and we're down the downward slope of flu. We're past the peak of our flu season, although it's still around. I think it's more related to we've had a significant amount of our flu activity has been related to an H1N1 strain, which doesn't create levels of severe illness, especially in seniors. So when you have an H1N1 season, by and large, we see less severe illness.
Next, we'll go to CBC, Jean Laroche.
Hi there. My question is 2 parts. One goes to Dr. Strang, and the other will go to the Premier. Dr. Strang, what's your recommendation for families with loved ones in a care facility who feel they may be safer outside that institution and they'd like to take them home? And Premier McNeil, if a family does choose to do that, the Premier or the province currently will only hold that bed for 30 days and then release it. Will you waive that particular rule so that a person can be cared for in family and then return to that care facility when the time comes?
So I think, Jean, that the family has to look at that. I mean, people are in long-term care facilities for reasons that they need levels of care. So my first question would be: Is the family really have the ability to provide the necessary care? The second piece would be that we have a lot of restrictions around flow of people in and out of long-term care facilities. We are now working to make sure even the workers who go in there have appropriate screening, et cetera. Unless the family has the capacity to put the same level of restrictions, if you will, and isolate their household to protect any introduction of the virus into the household if they bring their relative home, I would be concerned that families don't have the level of the ability to provide the necessary level of care, and in a lot of circumstances they may be putting their relative at more risk unless they have absolute capacity to apply the same level of restrictions and the same level of cleaning and all those pieces that a long-term care facility would have. And the third piece is that if somebody when their relative does become sick, long-term care facilities, we're supporting them to make sure as much as possible the residents who become ill can be cared for within the facility. And now, if their relative became sick, now we're going to have to take them to a hospital potentially, and there's a whole other issues that unfold from that. So, I would not encourage people to be looking to take their relative home from a long-term care facility for all the reasons I've outlined.
And Jean, we would work with both families who decided that that was an option for them to try to lay out, as Dr. Strang just identified, the pros and cons to that and the benefit of actually staying in their home. But obviously, if families decided to make that choice, then we would work with them and the operator on what would be the appropriate transition.
Jean, do you have a follow-up?
I do. This is for Premier McNeil. In his update earlier today, the Prime Minister talked about provinces either doing or offering medical resources to other provinces who are being harder hit right now with the pandemic. Can you tell me if Nova Scotia has shipped equipment or supplies elsewhere in the country? If so, why? If not, why not?
No, not to my knowledge at this time. What happened really universally across the country was, as you know, there's a new shipment coming in. Anyone who's been watching the news knows that in central Canada is hit extremely hard. Premier Ford and Premier Legault and their entire provinces have been under attack by this virus. You just talked about long-term care. There's 500 long-term care facilities in Quebec alone that are impacted by this. And I think it was pretty clear that the Canadian provinces were talking about new shipment coming in, that it obviously has to go to communities that need it today, with the assurance that if it was required here, that we would be able to get it in the next shipment.
Next, we'll go to CTV, Natasha Pace.
Thank you. My first question would be for the Premier. The 5 unions that represent healthcare workers have just sent out a news release saying that on Monday, they asked for the government and the employer to sign a document, a safety protocol document, to ensure that they feel protected and supported at this time of COVID-19. I guess the government has still not signed that document. I'm wondering why and if you intend to sign it.
Well, as Dr. Strang said in his opening remarks, there's evidence across the country where best practices that people are using. There's also supply issues. And the reality of it is, if we use up the supplies now, when we're at the front end of this virus, we could potentially end up like other Canadian provinces at 5 days left of supply. We want to make sure that in a clinical setting, when it is deemed that an N95 mask is absolutely required, that we have them. And if we start consuming that supply without knowing where the backup's going to be, we are potentially putting our healthcare workers at greater risk. But we're certainly willing. We've moved the letter that has come in has gone into the department and working with public health to have a look at it. We're doing our very best, and we'll do all we can to ensure that our frontline healthcare our workers are being protected in the short term and long term. Because if this virus ends up in Nova Scotia like it has happened in Ontario and Quebec, we will need a huge number of N95 masks at critical time. And we want to make sure that we have them for our healthcare providers.
Natasha, do you have a follow-up?
I do. For Dr. Strang, yesterday, Public Health issued an advisory about potential public exposure on March 15th at the Eagle Funeral Home in Westville and the Alma Fire Hall. I'm wondering today, is there any update to that? Have any additional cases been identified from those 2 particular locations?
Not that I'm aware of. That advisory just went out yesterday, and if people who had read that and had developed symptoms, I want to remind people, as I said yesterday, that the 14-day period has passed, so it would not be new people, but people who became sick in the 2 weeks since that event. But if they have come forward and been tested, they would yesterday or today, we would still probably not have the final results from their test at this point.
Next, we'll go to Global's Jesse Thomas.
Thank you. My question, it's looking, I guess, just kind of at the uncertainty and what could happen, the numbers. We saw Saskatchewan Premier Scott Moe request public health officials deliver some future modeling numbers. Meanwhile, New Brunswick Premier Blaine Higgs has requested the same. They're looking to get some numbers out next week. I know we talked about smaller provinces having issues. Yesterday we heard, but I'm wondering what's stopping the NSHA from providing the same transparency around the numbers in terms of projections.
So we are actually working on some modeling in collaboration between the Department of Health and Wellness and the Nova Scotia Health Authority. We look to bring that forward to next week, firstly to make sure we engage the Premier and the right people in government and see where we bring forward from there. I will make my point that I made again yesterday. This is a highly technical area that smaller provinces have limited capacity to do this. We are working collaboratively, a federal-led process, but at the end of the day, each province has to look at their own epidemic, and and we're all at different phases on it, and we have to do our own work. We're doing the best we can within the capacity in a very specialized area.
Jesse, do you have a follow-up?
Thanks, Christy. Yes, I guess we're 20 days in terms of cases. We've surpassed the 200 mark now. I'm just wondering if you can kind of give me a breakdown of how you feel about the numbers now. Are we testing enough? You had mentioned you're concerned about now community transmission spending. I wonder what signals are there. Just an update.
So as I've said previously, 2 weeks ago we were able to test a maximum of 200 a day in our lab. We're now up to 1,000 and can go beyond that. So and we've expanded our testing in a number of ways, which I've outlined previously, and we're looking at ways to continue to expand that, and we'll be able to speak more about that in the next few days, and looking at ways that we're making sure we're detecting a community spread. The fact that we're 200 in, is concerning, but this is the way this disease plays out. We can't prevent everything. What we can do is minimize the number of cases we get. We are going to get more cases, and we are going to get some level of a spike. How big that spike is, as I've said earlier today, it really is all of us working together will determine about how big or small that spike is, how many Nova Scotians become ill and critically ill, how much our healthcare system is expanded. Now is the time. It's that next 2 to 3 weeks that we can really ramp down community spread if we really focus on that, and that will spread things out. We are going to be in this for April and into May, perhaps even into June. But if we can slow it down, spread it out, we can get through this by minimizing the impact in our communities, allowing us of the level of illness to be within the capacity of our healthcare system, and we don't overwhelm our healthcare system. And quite frankly, it's how we also get out of this sooner. If we don't do the things we need to do, this will continue to go on with greater levels of spread and greater numbers of Nova Scotians being impacted.
Next, we'll go to the Port Hawkesbury reporter, Jake Boudreau.
Yes, this question is for Dr. Strang. I know you mentioned yesterday that you were supposed to have discussions this morning, and I'm just wondering if part of those discussions was in regards to home care support workers and restrictions. Specifically, what I'm talking about is whether there might be restrictions on the number of workers who visit a client, or there's going to be some prioritization of clients or things of that nature.
So I don't recall saying we're having discussions on those particular issues. We are developing or have been developed a robust set of guidelines for both for the home care setting as well as for the long-term care setting that have the Department of Health and Wellness with the Health Authority is sitting down with the Health Association of Nova Scotia, all the home care agencies and the long-term care facility agencies and companies working very much in collaboration to make sure that they have the information they need to run their operations, ensuring as best we can safety for both residents and clients as well as workers.
Jake, do you have a follow-up?
No, I do not.
Next, we'll go to Lindsay Armstrong with All Nova Scotia.
Hi there. Yesterday, Premier, you announced funding for small businesses on the Workers Emergency Bridge Fund. I understand that applications will be started to be accepted in the coming days. People are stressed about money and wondering how long they should wait before they expect to see money in their accounts through these programs. I'm curious to know what the timeline is like before the money gets rolled out, and how will these applications be processed and managed?
Well, the applications will be online first of the week. They are being processed and managed through Dalhousie in conjunction with their finance department, business school, a number of their students who are in co-op programs, placements will be part of this. They'll be. It's our goal that we'll start seeing checks written before the end of next week. Obviously, it'll take a bit longer when we're looking at the revenue source of April of last year or February of this year when it comes to the financing piece for the small business owner. But for those that are bridging, we're hoping we'll have those checks that are being direct deposit for sure in their account towards the end of next week.
Lindsay, do you have a follow-up?
Yes, I mean, we get reports about stressed out businesses. I'm wondering if you could just, what message do you have for them for the speed at which they should expect this support?
Well, I said as quickly as possible. We're putting it out next week. We've called upon Dalhousie, who has some expertise in this, along with all of their different faculty that have been working with us. We're reaching out to our sister universities with students, whether it's St. Mary's or local students here, to help us with processing so that we can get this in their hands as quickly as possible. We know that people are nervous and scared. People have been waiting for a period of time. What we try to do is work with the programs that the national government have made. It's why this program is Bridging is towards the self-employed or those who may not qualify immediately for EI. That way we can help bridge them. The national government has said they'll have the EI processed this coming week in direct deposits, and small business owners who are been forced to close from the public health order obviously have had their revenue sources impact. And that's why we want to put some money in their bank account to allow them to kind of weather this. Because I've said all along, if we follow the proper health protocols, we should see ourselves moving through this in some ways quicker than other places. But if we don't, then our economy is going to be impacted even longer. And my goal is to have people follow the public health protocols and then ensure that the entrepreneurs of our community are still in one piece to be able to come back into business, to be able to offer jobs and create the jobs that they were before for our sons and daughters. It will not be a smooth transition, and we're here to support them when we can, along with the programs that the national government has rolled out.
Next, we'll go to the Halifax Examiner, Tim Bousquet.
Hi, I have a question for Dr. Strang. First, thank you for responding to my colleague Jennifer Henderson's questions about Magnolia. My question concerns the impact on the healthcare system. That's a major reason why we have all these restrictions, besides just avoiding illness ourselves. But there are just 5 people in the hospital now, and I guess the fear is that in the future the system could become overwhelmed. Moving forward, will we have indication in terms of stats or numbers issued daily about the number of people in ICUs and the number of people using ventilators versus the capacity of the system?
So, we've just now started to do daily updates of the number of people in hospital. I'll take that back and look at that. We have to be careful about what we put up there, that especially when our numbers are small, that we don't identify somebody accidentally. But I'll take that back, and we can look at how we might do that moving forward. There's a number of things we could indicate about how the healthcare system is being impacted and what its capacity is, that as we get more robustly into this, so as I said, I'll take that back. I just want to make one point. You said that the primary objective of this is around protecting the healthcare system. That is important, but fundamentally this is all about saving lives. This is about knowing that if we do nothing, that a significant number of Nova Scotians will become ill and a significant number of Nova Scotians will die. I just want to stress that point. This is about caring for each other and saving lives.
Tim, do you have a follow-up?
I do. Somewhat related, the testing numbers are definitely going up. I think I recall you saying that we're now on the same date from the test being arriving at the lab to having a result. But there seems to be a lag of maybe a couple or 3 days because the positive and the negatives added together do not equal the total number of tests that you're saying are being given every day. So there's some uncertainty, unclearness about that. Can you help clear that up?
So I think we have to understand that you can't match up directly because we have a number. Some tests are indeterminate, have to be repeated. We have been, the lab has been supporting Saint-Pierre-Miquelon. If they have tests, they come into us. We did actually a couple of weeks ago. Moncton ran into some trouble, and we supported Moncton temporarily. We've done the same for Happy Valley, Goose Bay, being good neighbors. So you can't match up what we're reporting in Nova Scotia is not indicative of everything that's going through the lab. What I want people to focus on, though, that we have quadrupled or more the capacity in the lab in a very short period of time, and we have ability to go beyond that as necessary.
Next, we'll go to Cape Breton Post, Sharon Montgomery.
Oh, hi. Good afternoon. I'd like to ask a question of the Premier, please. I know the Premier just mentioned that he will be addressing home care. That was kind of what I'm working on, and I'm wondering if you could maybe answer a specific area of concern right now. Several home care workers have told me before entering a client's home, the protocol is now they phone from outside, they ask several questions as precautions due to the COVID-19. The workers say they've discovered on several occasions the client hasn't been honest on things such as sisters, being around somebody who has been ill. Apparently, the clients are scared if their service is discontinued for a certain length of time that they'll lose their spot and have to reapply for care. So the home care workers want to know if the province would intervene and secure the client's spot as it was done for daycare.
So first of all, these are unprecedented times we're in, and first the success of all of this will be determined by how hard we work at following the public health protocols and how honest we are about our own personal circumstances. If we've traveled, if we've been around people who have traveled, Dr. Strang spoke about that when people were going into hospitals. The same thing applies when a healthcare provider is coming into our house. We need to be honest and upfront. And of course, in this time, we would certainly not move someone out of the system because they said, we are going to prevent a home care worker from coming in for a period of time while we self-isolate or while we address the circumstances around it. So of course we wouldn't do that. But we need everyone to be upfront and honest about their own circumstances, their family circumstances, because ultimately we want to move through this as quickly as possible. We want to protect one another. And that means we protect our frontline healthcare workers, those that are in hospitals and those that are actually coming into our homes, provide that care. It's absolutely critical. It's absolutely critical that we be forthright and honest all the way through the steps of this system.
Sharon, do you have a follow-up?
Oh, yes. Thank you very much. I'd like to ask this question of Dr. Strang, please. The home care workers say their duties all still have to be performed: housekeeping, meals, personal care, and respite. However, given the seriousness of the COVID-19, they feel they should only have to be providing essential needs right now: meals and personal care. And once again, they say they are nervous and are wondering if you would share your feelings on this.
So I can't speak to specific circumstances around any individual and the care they're getting, but I think home care, as I said earlier, home care workers, we have provided substantive guidance to home care agencies and in the expectation that they would flow that down and provide the necessary training and education supports for their frontline staff. to the question of whether it's essential or not, I think I think home care agencies always work with that in terms of what is absolutely necessary for the client, and knowing that some of it is healthcare needs, but there are some people, they just need personal care needs, or even just some attention to their living environment, to make sure that it's clean, that they have meals, those kind of things, all of which are important to help people stay in their homes as long as possible. That hasn't changed just because we're in the era of COVID-19.
That's all the time that we have for questions today. So go ahead, Premier.
Thank you, Chrissy. Google has released graphs of people's movements based on data from our cell phones. They've done a scan across the country and took a snapshot of every province. At a glance, Nova Scotia is not doing well when it comes to staying away from our parks and beaches. We don't need online graphs to tell us what we need to do. We need to stay the blazes home. Today, Ontario provided modeling that suggested tens of thousands of people will die unless public health protocols are followed. We are modeling now, and we hope to have that model ready for next week. Our population is not much smaller than, is a lot smaller than Ontario, but the virus does kill, as Dr. Strang just said. And one death in Nova Scotia is one too many. I'm not trying to scare you, but part of me wishes you were scared. This is serious, and another weekend is upon us. I am so tired of hearing of grocery stores, Walmart, Tim Horton parking lots filled with cars, as if we are not in the midst of a deadly pandemic. We are. To the reckless and selfish, I am talking to you. A group gathering in a house, unnecessary trips outside, blatant disregard, the virus will find you. Then it finds your loved ones, and then it finds your neighborhoods, and then we have community spread. And then everyone is putting pressure on the public health to solve it, our healthcare system to deal with it, and government to pay for it, when all we have to do is stay the blazes home.